speaker is Kristin Kim Bart, who is dedicated to addressing inequality and violence in the lives of women and girls in developing and humanitarian contexts around the world. For the past decade, she has worked for the International Rescue Committee, both in the field programs and at headquarters. Currently, she is the Deputy Director for Women's Protection and Empowerment and oversees a team of 30 people who provide technical support, lead program innovation, and thought leadership on women and girls issues.
Thank you. Thanks. Sound of applause even before I said anything. So I'm really delighted to be here. Thank you so much for including us as part of this discussion. As Marcy said, the International Rescue Committee has developed and launched in 2012 the Caring for Child Survivors of Sexual Abuse guidelines. And these have been guidelines that we have used and other agencies have used, particularly in humanitarian settings. Certainly we know of the risks and vulnerabilities that really increase for children during conflict and displacement. And we also were becoming very aware that there were really no guidelines, really no resources and tools to support service providers, health and psychosocial service providers, whether they were government, whether they were community-based, whether they were NGO, to really guide them on how to deal with the issue of child sexual abuse. So my dear colleague, Abigail Erickson, dedicated I think several years of her life to developing these guidelines, and we found that they have been really a critical resource to really outline and bring awareness about what are the key knowledge and skills that service providers need to have, and really what are case management and targeted psychosocial interventions that can really help to support children. Since the guidelines have been launched in 2012, we have also developed and been a part of the development of training resources. What we were also hearing from our program teams once we launched the guidelines was like, that's a really big book and no one is going to read it all. So how do we instill knowledge in a real way for service providers ourselves and also those our partners that we work with on the ground. So we have developed a series of training resources and tools to really help instill this knowledge and capacity in service providers, and also provide some really fairly basic but very effective evaluation tools to help assess uptake in knowledge and usage of that in service provision. So I wanted to spend just a couple minutes and share with you all what we have learned about using these guidelines and responding to the issue of child sexual violence in humanitarian settings. Luckily, the guidelines have worked and the trainings have worked. Service providers have really improved not only their knowledge and skills, but I think equally important what we have heard is that service providers saying they feel more comfortable and confident addressing the issue. Something that was seen as very uncomfortable, they didn't know the words to say, they really weren't quite sure what was appropriate for a 5-year-old versus a 15-year-old, what do I need to know about a boy who has experienced sexual violence versus a girl. And so these guidelines, particularly in humanitarian settings, have helped to support the development of that. We've also heard that providers have learned and have begun to adopt and accept really important attitudes about the issue. That children don't lie about these types of experiences, that they're not to blame for what's happened to them, that they really need a very caring and supporting environment and services that can help them support and really tap into the natural resilience that kids have and really heal and recover. Another important piece that we have heard also is helping service providers to grapple with and understand informed consent, when and where that is appropriate and necessary, and also informed or assent and willingness to participate and accept and receive services. Myself, coming from a history and background of working in gender-based violence work and then collaborating with my colleagues who work in child protection, for years we were really butting heads against what were gender-based violence principles of working with survivors and trying to understand how to apply that for children and working with the concept of best interest of the child. So this is an area of the guidelines where I think we have been really instrumental in helping service providers understand that actually you can bring them together, and it's important to really think about developmental age, in the context and legal requirements in that setting. We also have heard that the guidelines go through quite a lot of detail around how to set the stage, what is an appropriate setting to really support and do a case assessment with a child of sexual violence. So that can be really basic, simple things. We all know about having private settings, but when we're talking about working with children, really making that, a child-friendly environment. Some bright colors of paint on the wall, some toys. We've worked with providers to have, culturally appropriate dolls and toys that children can use to help describe and show without having to say what's happened to them. We have found that our work in a healthcare setting in Dadaab refugee camp in Kenya, really took this approach on and set aside a private setting, really with not very many resources, brought together what was markedly a different environment than the clinical setting and the rest of the healthcare. And service providers in that setting really saying that they felt like that was really changing the way that they were interacting with children. They could go into this private setting, there were child-sized furniture, child-sized chairs, pillows to just sort of lay around as kids like to do and feel more comfortable about engaging with a service provider. We also have heard about building off of, there's a section in the guidelines on case coordination, right? As we've heard, it's not just one service provider, and really service providers really need to work together. So a couple of our programs have taken this on and developed something that they call the buddy system. Our programs in Tanzania have had key service providers, mainly from child protection and gender-based violence programs, individually identify their buddy on the other program. And so they work to really support each other, dealing with this issue and providing care for child sexual abuse is intense and emotional, and it's been helpful for them to have a colleague from another perspective and who's also trained and engaged in the issue. But it's also helped to identify, who's the primary case holder in any individual case. That certainly grew out of our own experience of, people really wanting to pitch in and help, but we certainly don't want children to go through multiple intake and assessment processes, not be clear about who are they supposed to go to. They have this helpful case manager and this helpful case manager and this helpful case manager. So really going through a process to lay out service provider agreements where service providers come together and in sort of a more intensive and detailed context-specific setting, really talk about what am I going to do, how are we going to identify what you are going to do, and how our programs and agencies agree on working together. The other thing that I wanted to just say briefly is, IRC has really taken a bit of a two-track process to this in terms of knowing that we need to work with service providers to build their skills and capacity to address this issue, but knowing the particular vulnerabilities of girls, developing programs that really also help girls to not only be able to protect themselves and live in a safer environment, but be able to learn the communication and social and emotional skills to be able to identify a dangerous situation, identify the needs that they have. So IRC has developed fairly comprehensive adolescent girl programs. That should say the prevention, that really focus on prevention and response to a broad understanding of violence, so including abuse and exploitation. And what this really focuses on is, like wraparound programming for girls. So keeping the girls at the center of our work and really looking at, as I've been talking about, supporting quality and coordinated programming and service delivery. We also work specifically with identified parent or caregiver that the girl chooses that is a part of the program. We do development of safe spaces, linking girls with a mentor, and really connecting them together. But as I said, perhaps most important for this discussion is working with girls to be able to really develop the emotional intelligence and understanding about the world and the context they live in, the risks and the transmission of HIV, what to do in a risky situation. That's okay, I can use my big words. And how to access services once they have experienced an incident of sexual violence. The program helps to facilitate girls and parents to work together to build that relationship so girls can identify their parents as a safe person and someone that they have developed the skills, and they know that their parent has also gone through some of the same understanding of what it's like to be a girl in that setting at this time. So happy to answer more questions about the work in humanitarian settings. I'm very excited to be a part of this and really look forward to sharing this really awesome resource with our programs as well.